All right, today I'm going to show you the medical assessment skill sheet. The tools that you'll need for that are safety glasses, gloves, a clear whiteboard, pen. You will also have a ghost partner who will then be taking your vitals. All right. So to begin this, BSI is my scene safe?
Scene is safe.
Scene is safe. All right, I have one patient. Do I only have one patient?
One patient.
MOI, NOI. I was toned out for patient with chest pain. I'm going to request additional resources. ALS, how far out are they?
ALS is 20 minutes out.
And then I'm going to check for C-spine precautions. At this time, looking at my patient, I'm going to skip C-spine precautions, but I could always come back to that if need be. So, general impression, I have a 34-year-old Caucasian male who appears to be in moderate distress. I'm going to go ahead and try and obtain a level of consciousness. How you doing, sir? My name is Matt Thompson. I'm an EMT with the U.S. Coast Guard. How you doing today?
Not too good.
Not today. What seems to be going on?
I'm having this really bad chest pain.
Yeah. What's your name?
Rod?
Rod. Rod, where are you right now?
I'm at Petaluma.
Do you know what time it is, Rod?
And sometime in the afternoon.
And what were you doing when you called 911?
I was just out for a jog around base, and then my chest just started to hurt.
All right. So my patient's A&O times 4. And then, so going after that, I'm going to check for some life threats. I'm going to just go ahead and look around my patient, check for any immediate life threats. Rod, you fall? Did you hit your head or anything like that?
No.
No? Okay, so my patient's chief complaint is chest pain, having trouble, maybe a little bit of trouble breathing. Is that pretty accurate? You said you had a little bit of respiratory distress?
Yeah, it's a little hard to breathe. My chest hurts really bad.
Okay. All right, so I'm going to go into my ABCs. So I'm going to check for airway. The Rod is talking to me. They have a semi-patent airway, so I'm not going to use any adjuncts at this time. I'm going to come on in, and I'm going to check for rate, rhythm, quality, and tidal volume, and simultaneously I'm going to assess his radial pulse. So for his breathing, for rate, rhythm, quality, and tidal volume, what am I getting?
His breathing is rapid and deep, and his pulse is 110 and strong.
Okay. And then while I'm right here, I'm going to pull the glove back on my hand. I'm going to check his forehead. I'm going to check for color, condition, and temperature.
It's pale, cool, and clammy.
All right, so Rod might be experiencing some shock symptoms, so I'm going to go ahead and put a blanket on Rod, and I'm also going to put Rod on a non-rebreather at 10 liters per minute. From there, I'm going to make my transport decision. So Rod's going to be a high priority transport due to the nature of his illness. All right, so I'm going to go into OPQRST. So Rod, what were you doing when this all started?
Yeah, I was just out for a jog around base, and my chest just started to hurt out of nowhere.
Mm-hmm. And Rod, what may provoke this? Was it the continuance of running that was provoking this? Was that what was going on, or were you maybe doing something else when this started?
No, it's just from running. It just came out of nowhere, and it's just not going away, whatever I do.
Even sitting down, it has not been alleviated?
No, it's just getting worse.
Okay. Now, Rod, is this radiating anywhere? So it starts right here in the center of your chest. Now, is this radiating to any other parts of your body?
Yeah, it's my
Just
left
spreading?
shoulder's hurting a little bit, and my jaw's hurting too.
Now, on a scale of 1 to 10, 1 being no pain, 10 being the worst pain you've ever experienced, where would you rank this?
It's like a 9.
And then, in your own words, can you explain what the pain is like?
It feels like an elephant sitting on my chest. A lot of pressure and a really heavy feeling.
And then, how long ago did this happen?
It started like 20 minutes ago.
All right. Rod, do you have any allergies, maybe to any medications, over-the-counter, prescribed, seasonal allergies, dog dander or pet dander, anything like that? Do you have any allergies?
No.
Do you take any medications currently, whether that be prescribed, over-the-counter, recreational, anything like that?
I was prescribed this nitroglycerin for my heart in case I needed it.
Do you have that on you?
Yes, I do.
May I see it, please?
Yes.
All right, so Rod has handed me 0.4 milligram sublingual nitro tablets, okay? And Rod, do you have any past pertinent medical history? Does this happen before? Have you seen the doctor for any cardiac issues in the past, or is there any family hereditary issues that you have?
Yeah, a couple years ago I had a heart attack, so that's why my doctor prescribed this to me in case this happens again.
Do you remember how long ago that was? Just a couple years ago, you said?
It's about 3 years ago.
Okay. And Rod, what was the last thing you passed orally, whether that be food, water, medication? What was the last thing you put in your mouth?
I had a protein shake and some water before I went for the run.
And just we're going to sum this all right back up. So you're out on a run. You started experiencing chest pain that started radiating to your left shoulder and your jaw. Sitting down did not alleviate this, and you call 911.
Mm-hmm.
All right. So we're going to do a focused secondary assessment at this time. I'm going to go ahead and take a listen to Rod's lungs, and I'm going to also go ahead and take a listen to Rod's heart. All right, I'm going to check 6 points on the back. 1, checking bilaterally. 2, 3, 4, 5, and 6. I'll go ahead and do the same on the front. 1, 2, 3, 4, 5, and 6. Are all fields clear?
All fields are clear.
Okay, I'm also going to go ahead and take a listen to his heart. Do I hear any abnormal heart tones or anything like that?
No abnormal sound.
Okay. I'm also going to go ahead and have Ghost, my partner, go ahead and take some vital signs. I need blood pressure, pulse, respirations, and SpO2.
Blood pressure is 138 over 86. Pulse is 112. SpO2 is 94.
And respirations?
Respirations are 21.
Okay. So my field impression is that Rod could possibly be having an AMI at this time. So I'm going to go ahead and initiate my proper interventions. So I'm going to go ahead and go through my 9 rights with my patient. So starting with T for expiration, I'm going to check the medication, see if it's expired. It is not. I'm going to go ahead. This is a sublingual nitro tablet, 0.4 milligrams. It's going to be put under your tongue, and it's going to sit there, and it's going to dissolve. When that does dissolve, you could have a bit of a headache, a bit of a head rush, burning sensation under your tongue, but all that is normal, and just let that dissolve slowly. So this is a 0.4 milligram nitro tablet for the amount. For medication, this is nitroglycerin. What that's going to do is it's going to be a vasodilator, so it's going to open up your coronary arteries and hopefully alleviate some of that chest pain and allow for more perfusion. This is the right patient for P, so on the bottle it does say my patient's name. And for education, so this sublingual 0.4 milligram nitro tablet, I'm going to put it on your tongue. It's going to dissolve, and like I said, it's going to alleviate some of that chest pain, open up those blood vessels, and help you out a little bit. Do you want to take this medication?
I'll take it.
So I need to ask you a couple of questions before we do that. Do you take any sexually enhancing drugs?
No.
Okay, not within the last 24 hours?
No.
And then I've already checked you over, but you haven't had any head trauma or anything like that?
No, I didn't fall.
Okay, so I am clear then, and you have a systolic blood pressure that is over 100 systolic. So that does clear me to assist you with this medication. So you would like to take this medication?
Yes.
Okay, so I'll give my patient 1.4 milligram tablet, and I'll place this under their tongue. I'm going to wait a couple minutes check for the right response, see if any pain has been, if there's any relief in chest pain, and if there's not, we'll go ahead and take another set of vitals, make sure his blood pressure is still over 100 systolic, and we can maybe then give him another tablet this time. And then I'm going to go ahead and document everything. So I'm going to also reevaluate my patient every 5 minutes, and then I'm going to go ahead and give my pass down to the oncoming EMS crew. So we have Rod. He's a 24-year-old white Caucasian male. He is ANO ×4. He was out for an afternoon run, jog, and then he started exhibiting some chest pain. He went ahead and called 911. Sitting down, the pain is not relieved, and the severity is at a 9. That is also radiating to his left arm and into his jaw, and this is coming on about 20 minutes ago. He has no known allergies. He is prescribed 0.4 milligram nitro sublingual tablets. He had a history of a heart attack 3 years ago, and he had a protein shake and some water earlier, so that was the last thing passed orally. His vitals are 138/86, pulse rate 112, SpO2 94%, which if it's still at 94%, we're going to go ahead and actually bump up that non-rebreather to 15 liters per minute and hopefully elevate that SpO2. And he has 21 breaths per minute. And that concludes the medical assessment skill sheet.